Hello everyone, my name is Emmett Walsh. I'm a medical herbalist at Roscoe Clinic. Today we're going to talk about the topic of cancer and the role that we can play here at Roscoe Clinic in the treatment of cancer. So I first was interested in this topic when I did a master's degree back in 2002 studying the integrative treatment of patients with cancer using herbal medicine and conventional treatments. At this time, one of the great areas of study that I have seen to be very, very helpful in the intervening years is the study of the work from the Pasteur Institute in Paris, which at the time was probably the leading institution in the world looking at the fundamentals of cancer and how it was initiated and how it was promoted within the body. And since then I still use much of what I learned from the Pasteur Institute, not alone in dealing with cancer, but also in formulating treatment strategies for many other conditions, especially chronic conditions. So the strategy that we use here at Roscoe Clinic to treat cancer or to play a role in the treatment of cancer would be some of the following areas. We can give specific anti-cancer herbs. We give specific anti-inflammatory herbs. The inflammation process within the body is central to the whole development, and nutrition can play a very significant and important part in responding to cancer. Digestive function, of course, is absolutely central. Without a good digestive functioning system, a person's energy and power can weaken and drain away. We have developed specialist anti-cancer formulations, some of which have been recently backed up by modern clinical research. For example, one formulation that we use, it has been shown clinically to be as good as or equal to, without any of the side effects, of many of the chemotherapy drugs that are used in the treatment of lung cancer, even advanced lung cancer. So we're very happy with that. Meditation can play a very significant and helpful role in the treatment of cancer. We generally try to support the immune system, and we do this before, during and after chemotherapy. As regards outcomes, we can, in certain cases, have positive outcomes where we're dealing with early stage cancers, and we do know from epidemiology and population studies that if we can intervene in people's lives at an early stage, that cancer risk can be significantly reduced. In the case of terminal patients, we have found that through our interventions that these patients have less pain and can cope with their condition far easier. We always make an assessment of the general health and immunity status of each patient and build up their strength. We have to consider a person's constitution in developing any type of a treatment program, whatever specific medical needs they may have. Central to the treatment of cancer patients is maintaining liver function, because for people who are on chemotherapy, the prime limiting factor as regards their ability to be able to cope with chemotherapy is liver function status. So we work on that and try to maintain that to help the patient. And of course, we will always look at the specific chemotherapy drugs that are used and the effects that these can have on the body, some of them short term, some of them long term, and cater for the needs accordingly. And and primarily we're looking at the area of cardiac support, digestive support, as I said, liver support and maintaining appetite. So that's it, folks. Thank you.